Hi there. I'm here to present my cellulitis case study PowerPoint. Cellulitis by Jessica Gorman. Case study background on our patient, Mr. Shannon. Mr. Shannon is an 80-year-old man who was admitted to the hospital for left foot pain and accompanied by flu-like symptoms. This patient cut the bottom of his left foot on a seashell while walking on the beach in Florida. The surrounding skin has become red and warm, and edema has begun spreading to the left foot and ankle. Mr. Shannon was diagnosed with cellulitis and has 101.4-degree fever, as well as an elevated blood glucose level of 200 milligrams per DL. All other vital signs for Mr. Shannon were within normal limits. He was prescribed IV levofloxacin, tramadol hydrochloride, and a warm aquathermia pad every 2 hours for 20 minutes at a time. The concept of cellulitis. What is cellulitis? Cellulitis is a localized bacterial infection of the skin that can occur anywhere on the body and is most common in the lower legs. Cellulitis is caused by a break in the skin barrier, which introduces organisms that invade and overwhelm defensive cells. The bacteria involved in cellulitis is typically Staphylococcus aureus or Streptococcus pyogenes, and it invades the surrounding tissues of the wound. Cellulitis is caused by cuts, scratches, grazes, bites, injections, eczema, contact dermatitis, psoriasis, leg ulcers, and tinea pedis, which is athlete's foot. The risk factors for cellulitis include making it easier for the bacteria to cause cellulitis to proliferate throughout the body. These risk factors include peripheral vascular disease, diabetes, edema, IV drug use and complications, burns, weakened immune systems, obesity, lymphedema, tattoos and piercings, trauma, and old age. If these risk factors are not taken care of, cellulitis can cause an abscess formation, sepsis, or can harbor necrotizing fasciitis. The concept of cellulitis, recognizing cues. Assessment findings that would be apparent in a patient with cellulitis include erythema with indistinct margins, a fever, red, warm, swollen, and a tender area of the skin in a localized area, regional lymph node enlargement and tenderness, and visible red streaking of the skin proximal to the area of cellulitis, and blisters, skin dimpling, and edema can be present. Some labs and imaging that are part of cellulitis include an elevated white blood cell count with differentials showing lymphocytes and neutrophils, an elevated ESR, C-reactive protein, and positive culture and sensitivity test. X-rays can show gas bubbles in the soft tissue indicating cellulitis. Ultrasounds can identify abscesses, and computed tomography scanning is used if necrotizing fasciitis is suspected. Analyzing cues. What do the findings from the assessment labs and imaging mean? Fever, redness, warmth, and localized swelling are part of the inflammatory response to the bacterial infection of cellulitis. The inflammatory response is meant to neutralize, control, and eliminate pathogens and prevent them from surviving and multiplying within the body. Edema and erythema, as well as enlarged and tender lymph nodes, are signs that the infection is spreading and has become systemic. Elevated neutrophils, lymphocytes, ESR, and C-reactive protein are all signs of infection which occur during the inflammatory response. Finally, the inflammatory response will enact the immune response, which is the body's attempt to protect itself from harmful substances. So some nursing interventions for cellulitis include checking the distal pulses to verify perfusion, the RICE method, and soaking feet in warm water. RICE stands for rest, ice, compression, and elevation of the affected area. A heating pad can be applied to the affected area for 20 minutes at a time and every 2 hours in Mr. Shannon's case. Washing hands before and after touching the area is extremely important. Encouraging the patient to intake enough protein and have enough exercise. Bed rest can be ordered if the infection is severe enough. It's important to monitor the patient's vital signs, especially their temperature. Reassess the wound size, color, and drainage often, and document your findings. Look for any signs of a DVT or super infections that can occur, and monitor trends and or changes in the lab values. The concept of cellulitis, evaluating effectiveness. So how do we know if our treatment was effective? The swelling, redness, warmth, and tenderness will be reduced in the area. The patient's temperature will be within a normal range. The lymphocytes, neutrophils, ESR, and C-reactive protein labs will be no longer elevated. And the pain will be reduced, and the erythema will no longer be spreading. Okay, so for my skills, I had skin assessment and PO medication administration. There's my skin assessment, and I'm going to try to play the video here. Bear with me. Oh, no, it's not time for that. My skin assessment includes initial steps, such as providing privacy, introducing myself, getting the 2 patient identifiers, performing my hand hygiene, asking the patient if they have allergies, and providing patient education. I will then inspect for skin color, check the head and scalp for infestations and any other abnormalities. I would look for moles, check the temperature, moisture, texture, skin turgor, hair distribution, especially on the legs, wounds or lesions, edema of the lower extremities, check the nail beds on the hands and feet, check cap refill, look for blanching and reddened areas. And for my PO med administration, same thing with the initial steps. I would provide patient privacy, introduce myself to the patient, have my identifiers, and check the wristband, perform hand hygiene, check for patient allergies, provide education, and then including verifying the orders with the MAR and following the rights of med administration. I'll make sure the patient is sitting upright and that they can swallow effectively. Provide them a glass of water and make sure to observe them swallowing, and then discard any supplies, clean my hands, and document correctly and make sure the patient is safe. Okay, here's the skill demonstration videos I was talking about. Skin assessment video, and we'll start here. Good morning. Today I'll be performing a skin assessment on my patient, Mr. Smith here. I would start by providing patient privacy. Then I would introduce myself as a nursing student from SPC. I would clean my hands, and then I would ask the patient for his name and date of birth and check his wristband. Next, I would ask the patient if he had any allergies, and then I provide patient education by telling him that I'm going to be doing the skin assessment today and any other information that might be included. I would start by providing coverage of any areas that aren't being examined currently. Then I would look at his skin color. I would look for cyanosis, jaundice, and pallor, which obviously he has pallor. I would then go for his scalp. I would feel for any lesions. I would check for hair distribution and for the color of his scalp. Next, I would check for any infestation, such as lice or any other kind of infestation he could have. I would look for any moles or ecchymosis or vascularity. I would then palpate the skin temp and feel for any moisture or dryness and note the temp. I would then check his skin trigger to see his hydration status. I would pinch the skin above the clavicle, and then I would look for it to flatten within 3 seconds. Then I would look for any wounds or lesions or bruises. And if he did have any wounds, I would note the size, the shape, the location, the color, and any exudate. And if there's exudate, also the scent of the exudate. I would then go down to his legs and I would check for edema. He doesn't have any edema. I would also inspect the nails on his hands and his feet. I would look for clubbing on the fingers. I would check the nail bed and see if it's intact. Then I can do capillary refill and squeeze his fingernail and look for blanching, and then watch for it to go away within 3 seconds. I would also check posteriorly for any pressure injuries. I would look at the bony prominences like his elbows, the backs of his knees, and his buttock. I would also look for any areas that are reddened or have ecchymosis throughout his body. Okay, and then we're moving on to the PO administration video, and here it is. Good morning. Today I'll be performing my PO medication administration with my patient, Mr. Smith here. I would start by providing patient privacy. Then I would introduce myself as a nursing student from SPC, and my name is Jessica. Then I perform hand hygiene and ask the client for his name and date of birth and check his wristband to make sure that matches. I would then ask the patient if he had any allergies and provide education about the medicine that I'm going to be giving him. Today I'm going to be giving him tamsulosin. It's an alpha blocker that produces more urine. I would verify the orders for the prescription on the MAR and with whatever the doctor ordered. And then I'd follow the rights of medication administration. Those rights are right drug, right patient, right time, right reason, and then I'd do right documentation, right route, and right education, and right to refuse. Next, I would make sure the client is sitting upright, and I would perform aseptic technique to give him his medication. I would take the pill and put it in a medication cup, and then I'd provide him with a glass of water, and I'd stay at bedside until he swallowed the pills. These pills can also not be crushed because of the coating that they have. Once I see the client take his pills, I would then discard any of my materials, take off my gloves, and clean my hands, and then I would document my findings and the time that I gave him the medication. Thank you. Okay, those were my skills and my case study information. And thank you for watching. Hope you have a great day. Thank you.